Welcome back. In this video, we'll talk about pulmonary hypertension. It is defined as having a pulmonary pressure of more than 25/8. This is mostly idiopathic, but it can be caused by anything that would increase the backup pressure in the lungs. So I think of COPD, lung fibrosis, pulmonary arterial diseases. These diseases would start a positive feedback pathway. The pulmonary vessels will constrict and cause hypoxia, which will cause pulmonary hypertension, which will cause more hypoxia, which will cause more pulmonary hypertension, and so on and so forth. Symptoms-wise, we expect the patient to have fatigue with dyspnea, and these are the hallmarks. Chest pain is also common. In severe cases, we'll see some cardiac symptoms, such as pulmonary valve insufficiency, or loud P2 sound when listening in the tricuspid area, and also syncope. And wide splitting of the S2 is also very common. The best initial test is chest X-ray plus CT, and we expect to see dilation of the proximal arteries and narrowing of the distal arteries. The most accurate test, which is very commonly mentioned in the exam, is the right heart catheter, which is also known as Swan's-Ganz catheter. This is the most precise and most accurate test, and it's very commonly used. If we do an EKG, we'll see a right axis deviation of the heart with enlargement of the right side of the heart. And this makes sense because the lungs are clogged up, and so the right side of the heart has to push harder and harder to get the blood into the lungs. And over time, it will hypertrophy and increase in size. This can also be confirmed by echo. The treatment is correcting the underlying cause if we know it. But like we said, the most common cause is idiopathic, and we don't know the cause, so the treatment is as follows. We start with prostacyclin analogs, and then we use endothelin antagonists, and then we use phosphodiesterase inhibitors like Viagra, and finally we can use cyclic GMP stimulants. The only definitive cure and treatment, however, is lung transplant. And here's a small quiz. And here is the answer. Alright guys, that's all I have, and thank you so much for watching.